Hi, this is Pastor Barbara, aka Preacher with Parrots. Today is the 6th of February 2017. This is not a live broadcast, although most of what is on it, on this video, has been shared with my Bible study group. About a month ago, I think it was on the 4th of January, I put up a couple videos regarding pain management versus drug addiction, the difference between the two. And it was my intention within a week or two to make some other videos. I was doing a lot of research because of something that had happened to me over the Thanksgiving Day long weekend. And I wanted to wait until that matter had been settled before I went any farther. But I knew from the very beginning that there had been a change in what pain management was 35 years ago when I first learned about it and what it is now. I was so shocked. I couldn't believe that so much had happened, so many changes had taken place, and I didn't have a clue. I had begun pain management after I suffered a surgery which was botched. The dura, which is around the spinal cord, was ripped during the surgery. And for a couple of years, I had spinal fluid leaks. When my stitches were taken out, I had so much spinal fluid inside of me that when the pressure built up inside and the stitches, the metal stitches were no longer there to hold everything together, about 20 minutes after they were taken out, they just blew open and we had a gallon of spinal fluid and zero sanguius on the floor. And I continued to have other surgeries and so forth. I became a pain management person. I was taken to a wonderful place in Long Beach Memorial Medical Hospital, where they did a lot of tests, MRIs, a lot of tests, along with a lot of work in the gym, a lot of medication, many modalities were taught me how to deal with pain. And I learned so much, and I thought I knew so much. And when I realized that things had been changed, and when I learned over this past year that they were no longer teaching people how to control their pain, and there are many things that work a little, nothing takes it all away. But pain management means you manage pain rather than let pain manage you. And I knew immediately that I had to share with other people what I knew. Not that I know so much, not that I'm a know-it-all, but if I know anything that might help somebody else even a little bit, I'm not only pleased to do it, but I feel obligated to share with them anything that might make their life easier. I just got through, I'm not going to say reading, but looking over 52 pages put out by the CDC, the Center for Disease Control, on what doctors need to do before they prescribe medication. 10, 15 years ago, the government decided we had too many people dying of drug overdoses. And I think we all, I mean, 5 people a year is too many. I think we all agree. But like many things the government does, they come up with some idea, just discuss a little bit of what it has to do, make all kinds of rules that are totally untried, and then require that other people do it. I was reading, I've done a lot of research in the last 2.5 months. I was reading in a case in Florida, certain area. 24 people out of 100 that died had alcohol in their blood. Now, if you're old enough, have a driver's license, you can buy liquor, you can get drunk, you can get sick, you become a dangerous driver. 14% of the people who died in that same area, in that same time, had drugs. Now, we're going all the way from aspirin to morphine or something even stronger. Not all hard drugs, but had drugs in their system. Nobody said anything about the 24% with alcohol, that anybody with without insurance can go buy. Or many, many, many other things that are bad for you that the government controls. But the big deal was made about the lesser amount of drugs. And so what do you do? What's the government going to do? They want people to take less drugs. There's no point telling an addict or a recreational user or a person who takes drugs to get high, a person who takes drugs because they can't deal with their life. There's no point in telling them, now don't take drugs, it's not good for you. And the people aren't going to say, okay, we won't. That's not going to work. They know it, we know it. So what did the CDC and the Drug Enforcement Agency, the DEA, what did they do? Well, besides write 52 pages that doctors, I suppose, are supposed to memorize on how to prescribe drugs if they feel they absolutely have to. Now, the government has basically said there are 131 schools, universities in the United States where you can go to study and become a doctor, and only 5 of them teach anything about pain medicine. They go on further in their explanation to say, all these years your doctor has been prescribing medication for you. He doesn't know what he's doing. Amazing that people like myself have gotten to be as old as I am when doctors supposedly have been so stupid. But doctors have a lot to lose by not doing what the CDC or the DEA says. The addicts on the street have nothing to lose. Doctors do. And so they have suggested that while doctors could treat their patients if they absolutely insist, number one, they must reduce the amount of medication they're taking. I don't know, I have never known a doctor that's given any more medication, especially if any narcotics are involved. It's anything that's not over the counter, a bit more than a patient needs. Doctors don't do that. And doctors aren't that stupid. I wish some of the people coming up with these rules had half the education and half the caring about other people that doctors have. How long does your doctor spend with you when you go to see him? One of the things that they required in the past couple of years, or the last year or so, was that the doctor call the state to see if you've gotten drugs from another doctor besides yours or from another pharmacy. Now that's going to take what, 3-4 minutes to do it on the computer? And that's every time he writes the same person, the same subscription that he may have written for the last 5, 10, or 20 years. And in my case, every doctor I've had, except for recently, every doctor I've had that is prescribed for me, I've had for 15 or 20 years. From the time I was born till I went to Bible college, I had one doctor, K.L.E. Cantor. From the university that I went to until he retired, I went to Dr. Lowell E. Schaefer. And then I went to the fellow that he brought into his practice for a while. And then after my surgery is plural, I went to another doctor for 15 or 20 years until I moved. Then I found another doctor that was just starting his practice, and I was with him for 15 years. You think these doctors that you have that long don't know you, that every 12 times a year, they're going to need to call and see if you have become a naughty person or an unresponsible person in that period of time? Well, let me get on. Many people have tried various narcotics, drugs. Opiates is the name for a group of medications. They're fairly strong. Doctors don't give them until they try other things. But there's 2 or 3 medications that work when other things don't. And patients who have taken them have kind of gotten their life back. Most are able to work. If not work, at least get up, dress themselves, do things around the house, talk to neighbors, go to church, get their groceries, that they couldn't if they weren't taking this medication. Doctors have a choice of trying to get their patients down to taking no medication at all, but they're given another option. Wow. This option is you can go to a pain clinic and you can talk to one of these doctors that's been to one of these 5 places, and they're specialists and they know everything. And you can be a patient there. And I don't know any doctors that know what goes on in some of these pain clinics. I didn't. I learned personally in the last year but I've spent 2.5 months researching besides the time I spent in one. Let me tell you how the people who have been in them feel. 88% say they feel they have a right to help make a choice what medicine they'll have or what procedure they'll have done to them. And 88% feel that they're not given a choice in these clinics. 71 have changed doctors, and if they're unhappy, they're afraid to change because they'll be listed as a person who goes from doctor to doctor to doctor to doctor searching for drugs. 52% feel that there's a stigma attached to people that take strong medication, that people are going to say, if you were a stronger person, you wouldn't need to do that. 27% have considered suicide as a possibility. I'm going to talk more about that in another video. And by the way, I need to say this is the video that everybody needs to see before the others. The other videos are going to be much more interesting. I'm going to show you, for example, my medical records. Every page has a minimum of 3 mistakes on it. And I paid for it. Those things will be a lot more interesting to view. But these are things you need to know and understand for the rest of it to make any sense. For you to know what some people are going through. And you can't change something overnight. Remember, what yesterday was acceptable medical practice. This is what all doctors do and are expected to do at this particular time in history in this particular country. This is the acceptable medical practice. You know what the acceptable medical practice was years ago? Well, bloodletting was part of it. Like, you could go down and donate 4 units of blood, not get a cookie or orange juice, and that would cure you of whatever ailed you. If a woman was nervous, how about being fondled? Was the acceptable medical practice. What about the little tube, like a little tube of stuff to brush your teeth with, toothpaste? Had morphine in it. And it was perfect for stopping little babies who were too fussy and bothering their mothers. It was perfect for them. It was acceptable medical practice in this country not that long ago, before my lifetime. Most of it, not all of it before my lifetime, but most of it. It's not acceptable now. And things that are being done now, I'm sure, will not be acceptable medical practice in the next 20 years. But what about the people who have to live through that time? You go to a pain clinic, you sign a contract. I have read a few of them in my research. First of all, you promise that you will only take what the doctor gives you and nothing else. You won't drink alcohol. You won't doctor shop. I looked at one for the first time. I didn't have a problem. I don't drink alcohol. So saying I'm not going to drink alcohol is not a problem for me. I don't abuse drugs, so saying I won't is not a problem for me. I don't mind being tested to see if what I'm telling is the truth because I do what I'm supposed to do, take what I'm supposed to do. I don't have a problem with it. So at first, I didn't see a problem. But you try living with it. You will learn in another video what some people go through because they sign them, what I went through. But that's another video. As I said, a little bit more interesting than this one that just has statistics and commentary. And you know, there are a lot of people in the periphery of medicine that don't know these things that I'm telling you. When I say the periphery of medicine, I'm talking about like maybe foot doctors, doctors that examine your eyes for glasses, dentists and so forth. They are, yes, they're part of the medical world, but they don't do surgery on you and so forth. But yet they know a lot about medicine. I talked to one earlier, well, a week ago today, and he had no clue. No clue. Some of these pain places are considered shot mills or pill mills. You don't go to get treatment. You don't go to get better. You go to get 30 times whatever pill you're supposed to take a day. If you don't go in, you don't get your month's supply of pills. I want you to know pain management is not this month you take medication, that month you don't, this month you do, that month you don't. Pain management is every day managing your pain. Anytime you don't do it right, you pay for it. And people in pain management in the old days used to manage their pain. Take it from me, that is not managing your pain. Something I would have read to you if I would have thought, and I would have pulled it up on one of the computers, but I'll do it on another segment, on another video. One of the contracts, well, one, I was really surprised. It said, if I don't do what the pain doctor says, I will be fired. Have you ever heard of anybody being fired from a doctor? But you can get fired, and people do. Sometimes people will get an email or a phone call and saying, don't come in, we fired you. You didn't pass this test, or we found something we don't like, and you're out of here. And that means whatever medication you were taking, you suddenly don't have. One of them said, before we fire you, we will give you enough medication so that you won't go through withdrawals. And after reading some of the contracts that I read, I thought that one was a pretty nice one. One of them actually said, anything that goes wrong is my fault, and I hereby advise my family not to sue the doctor. If I die, it's my fault and nobody else's. Can you imagine signing a contract like that? These people feel that a doctor has power over them. They supposedly treat two kinds of people in these places. They supposedly treat people who are addicted to narcotics and people who take medication regularly because they have a medical problem and the medicine helps them. Between the numbers I've read are between 5 and 15. It's probably more like 10% of the people who take medication for pain might get addicted. People have different kinds of personality. Some people are lazy. Some people don't ever want to feel any pain. And it's logical. By the way, did you know that Dr. Phil and President Reagan and President Trump and I have something in common? We all grew up in a home with an addict. Trump does not allow alcohol, cigarettes, or drugs in the house. He had a brother who was addicted to alcohol, and it cost him his life. That made such an impression on him. He does not allow it in his house. I don't know the details about Reagan. I know a little bit more about Dr. Phil. His father was an alcoholic. I know that when you live with that, you want to get away from it as soon as you can. There's a reason I went to Bible college at age 16. It's not that I'm that brilliant, that I needed to go to college before I was 18. You don't want to be around anything. And I went through 3 different, I saw somebody go through being addicted to 3 different things. Now, the first one, you would say, that's nothing. But I saw what that person would do to get what they felt they needed to have. Then the second thing they were addicted to was worse. And then the last was just outrageous and probably brought on death. And so I remember when Dr. Phil had his 1,000th or 5,000th or 10,000th program or whatever, and he invited Oprah to be with him. See, you probably saw these same shows. You probably heard these same facts, but they didn't mean to you what they mean to me, because I've lived it. And so somebody brought out, Oprah was his guest, and somebody brought out a little tray and brought her a glass of champagne and brought him a bottle of water. Because those of us that have spent time with an addict stay as far away from it as we possibly can. I'm going to close this video. On the other videos, they'll be perhaps a little bit more interesting. I'm going to read to you what some people have gone through. I'm going to give you some other statistics, but in another video. But this one, I hope you see this one first, because you need to know what it's all about. You need to know that the government, somebody just dreamed this up. You know, give them a problem. They'll say, okay, we'll fix it. They'll come up with a couple of rules and require that everybody do them, and nothing gets fixed. And in the meantime, you'd be surprised how many people are suffering. And until the next video, God bless.